So, a very good afternoon to each and everyone watching us live from across the globe. So, today, as we know, we are gathered here for a webinar on safety of food and food workers in the COVID-19 pandemic. So, with us today is our keynote speaker for the afternoon, Dr. Pradip Chakraborthy, sir. So, welcome to the webinar. So, Dr. Chakraborthy, having a rich experience of more than 35 years in the field of food processing, quality control, project management, and export of processed foods, worked as a production manager in the first 100% export-oriented fish processing unit of Andaman and Nicobar Islands at Port Blair, which was set up and operationalized by him, besides setting up a food park in West Bengal. Dr. Chakraborthy, who was on deputation with the Food Safety and Standards Authority of India, FSSAI, very successfully held various senior positions like Director of Product Approval, Director Jones, Nodal Officer for Scientific Panel on Food Additives, Flavorings, Processing Aids, and Materials in contact with food, and done his best to expedite cases on priority. Dr. Chakraborthy has written a number of technical articles on food safety and related topics for various national and international journals. He has translated Food Safety and Standards Authority Act 2006 in Bengali. Keeping in view his vast experience and contributions to the food industry, All India Food Processors Association conferred him AIFPA President's Special Award for the year 2013. After retirement, he is working as food safety consultant, visiting faculty of D.Y. Patil University, and senior advisor, Center for Public Health and Food Safety. Sir, we welcome you to the webinar, and now we would like you to greet the audience and start your presentation. Over to you, sir.
Good afternoon to everybody. Today I'm going to discuss on safety of food and food workers in COVID-19 pandemic situation. This is a very extraordinary situation, and most of the companies, even technologists, are not aware of how to tackle this situation. So I'm going to discuss on this issue, and I have already written a guide notes on sanitation and hygiene requirements, COVID-19, prevention measures, ensuring safe food and food workers' health on 9th of April 2020. It has been posted on LinkedIn by Jocelyn Lee, contributing editor from California, USA. And it has been translated into 15 different languages by my fellow food safety professionals across the globe. And all these translated versions also posted on LinkedIn by Jocelyn Lee from California, USA. So you can have a look on it. And in view of the immediate situation of COVID-19 pandemic situation, the importance of sanitation, the importance of hygiene sanitation in food processing industries, particularly which are very perishable, which are handling perishable commodities, is once again emphasized by the organization WHO. In its interim guidance dated 7th of April 2020 for food businesses, WHO emphasizes the need of food safety management system (FSMS) based on HACCP, hazard analysis and critical control point in the food industry. So they have emphasized on FSMS based on HACCP. Hygiene and sanitation are two basic yet compulsory requirements in any industry, particularly food processing industry. A number of guidelines have been issued by the FSSA, Food Safety and Standards Authority of India, to prevent and control microbiological hazards in food products. Hygiene and sanitation requirements of the establishment where raw, unprocessed, and finished food products are handled has great significance on the quality and safety of the food products. And in this pandemic situation, we have to take care of the safety of the food workers as well. So hygiene and sanitation requirements of all working personnel and food packaging handlers in the establishment is equally important. Next slide. Next slide, please. Yeah, I have already explained this. So next slide. Next, yeah, right. So So failure to maintain hygiene and sanitation jeopardize the entire process and integral safety of the finished product to the consumers, because whenever we are manufacturing any product, it is ultimately to be consumed by the consumers, and we have to ensure safety of the consumers as well as workers and the products. So failure to maintain hygiene and sanitation jeopardize the entire process and integral safety of the finished product to the consumers. So enforcement of stringent maintenance of hygiene and sanitary conditions in the establishment and personnel is a precondition to obtain a license from the FSSA for a food business operation, for manufacturing or anything. So this is a precondition actually. Schedule 4 of the Food Safety and Standards Licensing and Registration of Food Businesses Amendment Regulation 2018 elaborately uh, explains guidelines relating to general practices on hygiene and sanitary practices. And these requirements are mandatory. Actually, these requirements facilitate the industry to implement strong, good manufacturing practices (GMP) and good hygienic practices (GHP). So, the implementation of GMP and GHP is essential in food industry. Next slide. Next slide. Yeah, personal hygiene. Personal hygiene is very important to maintain the safety of the personal as well as the product. Uh, in fact, there is no evidence to date of the COVID-19 virus being transmitted via food or food packaging. There is no such evidence. Coronavirus needs a human host to multiply. It cannot multiply in food. Hence, it is imperative for the food industries to reinforce personal hygiene to avoid contamination of food. Hand washing plays a very important role, we all know, and it has been said by WHO, all the authorities, time and again, that hand washing plays a very important role, even for the consumers. So adequate for hand washing, actually adequate quantity, size and means of hygienic washing, drying and sanitizing hand facility, including wash basins, supply of potable water at suitable temperature, liquid hand soap, single-use disposable paper towels, wall-mounted hand dryer, sanitizer with at least 70% alcohol content should be provided in the establishment. So this provision must be there in the working in every establishment. So proper ways of hand washing with hand soap shall be explained with pictorial demonstration also. And these posters should be located at the entrance, storage, distribution, handling of the food processing unit, and all the prominent places in the inside the establishment. Next slide, please. Next slide. Yeah. So workers should change out the street clothing as soon as they enter the establishment. They should wear clean company issued PPE. PPE means personal protective equipment. We all know by this time what is PPE. So they should enter. They should wear clean company issued PPE daily before entering food processing areas. Adequate changing facilities for personnel shall be provided. Even the supervisory staff shall not enter the food processing areas without changing into clean company PP. So everybody from supervisor to the workers, even the visitors also will have to take care of this. So this is a new thing actually we are acquainted with nowadays. So next slide, please. Next slide, please. Yeah, good hygiene practices, GHP. So good hygiene practices in food processing premises include number one, proper hand washing with soap and water for at least 20 seconds. It has been prescribed by WHO and it has been accepted by all the authorities in the world. And so proper hand hygiene washing, proper hand hygiene washing with soap and water for at least 20 seconds, and frequent use of 70%, minimum 70% alcohol-based hand sanitizers also constitute a part of good staff hygienic practices. Good respiratory hygiene That means covering mouth and nose with inside bent elbows sleeve when coughing or sneezing. Change to clean PPE and immediately properly wash hands before returning to the processing area. So use only tissues provided by establishment. Don't bring any tissue from the house. So it should be used what is provided by the establishment only in toilet rooms. That too only in toilet rooms, not everywhere. And discard tissues immediately in waste receptacle. Wash hands thoroughly immediately after discard of tissue. And number 4 is routine frequent cleaning, disinfection of work surfaces and touch points such as door handles, equipment handles, power switches, hose nozzles, phones, toilets, etc. So that is also an essential part of GHP. And number 5 is avoid close contact with anyone showing flu-like symptoms of fever and respiratory illness such as fatigue, sore throat, dry throat, shortness of breath, coughing and sneezing. So these 5 points are very essential to maintain GHP. When worker observes a co-worker or visitor or contractor with such symptoms of flu-like symptoms, sore throat or something like that in the facility, they should report this matter to immediately to the person in charge of the establishment, PIC of the establishment. And please remember that wearing disposable gloves and use of hand sanitizer are not substitute for proper hand washing, because hand washing is very effective. Proper hand washing is a greater protective barrier to infection than wearing disposable gloves or using hand sanitizer. We always suggest that you should do proper hand washing and then dry the hand properly. Always properly wash hands before wearing disposable gloves. Even if you wear disposable gloves, actually before that also you should wear, you should clean your hands, wash your hands and dry it before wearing disposable gloves. Next slide, please. Next slide, please. Yeah, visitors, because we cannot avoid visitors, absolutely, even in pandemic situation, but visitors entry in the establishment should be minimized. So generally visitors should be discouraged from entering food processing areas during processing. Even when they are allowed entry, they shall wear PPE like all other workers. And when they are allowed entry, actually this is a must. They shall wear PPE and face mask coverings, hair restraints, footwear, proper footwear, etc., and adhere to all the GHP requirements which are required for ordinary workers even. So, but best thing is to discourage visitors to enter food processing areas. For the immediate COVID-19 pandemic situation, only essential visitors will be allowed entry to the food facility. They shall be medically screened before being allowed in the food processing areas, because nowadays we see that even everywhere actually they use thermal guns to check the temperature, and then only they allow a person to enter any premises. So, so visitors should be more or less discouraged, but we cannot always avoid entry of visitors, because sometimes maintenance staffs and and the and the supervisors also, they enter the premises, and we cannot tell them not to enter because they are required. So, but we can minimize their visit actually. So visitors, regarding visitors entry, these are the GHP to be followed. Next slide, please. Next slide, please. Yeah, personal cleanliness and PPE. Personnel involved in food handling shall maintain high degree of cleanliness to ensure safety of food. And when entering food handling processing areas, both high risk and low risk areas, we know that in food processing premises, actually we know that there are 2 types of areas. One is high risk areas, and another is low risk areas. Particularly receiving places are low risk areas, but what processing is done, these are high risk areas. So when entering food handling processing areas, both high risk and low risk areas, personnel shall wear actually PPE clothing. Without PPE clothing, they should not be allowed, and they should wear face mask covering, respirators, hair nets, beard snoots, because if the worker or supervisor or visitor are bearded, actually they should wear beard snoots, hand gloves, and proper footwear to ensure the product, food contact surfaces, and packaging materials are not contaminated, because our main intention is to ensure safe food and safety of food workers. So face masks to be changed every 4 hours. We suggest that they should change the face mask every 4 hours. Immediately after face mask become damp also, if it is damp for weather condition or the working environment, then they should immediately change the face mask once it is damp. And immediately after sneezing or coughing in face mask, if that should be discouraged. But if it happens also, that face mask should be changed. And before placing new face mask, all personnel must wash and dry their hands. And where gloves are used for the product contact, because sometimes gloves are used actually, and these gloves actually shall be single use, clean and free from tears. These should be disposable gloves. So same gloves should not be used again and again, even after shift. So staff who handle raw material must not work in ready to eat food areas. That means from low risk areas should not workers from low risk areas should not enter high risk areas, and they must not handle food under processing and packed food unless they have fully changed their PPE. So all workers, all workers shall properly wash their hands with hand soap and potable water, followed by proper drying before and after touching and wearing PPE, face mask, face coverings, respirators, eyewear, beard snoots, after handling chemicals, after handling raw materials or finished product, after handling dirty equipments, trash receptacles, dishes, utensils, after every break, after returning from storage, after coughing or blowing nose or sneezing, after touching the face or hair, after using toilet facilities, after doing anything that could contaminate the hands, including handling money. So we have to take utmost care that workers should adhere to all these norms. So proper hand washing and drying plays a very important and crucial roles, and adherence to GHP is very important under the circumstances. Yeah, next slide, please. Next slide. It's a continuation of the slide. Next slide. Yeah. So all workers shall keep their fingernails clean and trimmed, because we know that fingernails contains a lot of dirt, and it may contain bacteria and viruses also. So all workers shall keep their fingernails clean and trimmed. No nail polish, false nails, false eyelashes are allowed. So this should be strictly maintained, particularly under this peculiar situation. And facial and body jewelry, including facial piercings, earrings, bangles, bracelets, watches, necklace, hairpins, and rings shall not be allowed in food processing areas. It is a common thing actually. Even it is always not allowed actually. These things are not allowed. This facial and body jewelry. And unhygienic practices such as smoking, chewing, eating, sneezing, or coughing over unprotected food, food packaging, food contact surfaces, spitting even into a trash bin shall be prohibited. So these are very crucial things actually. Even spitting into a trash bin shall be prohibited. So you have to take the highest level of GHP. So all the workers actually, and we must be very serious and sincere about it. So next slide, please. Next slide. Yeah, layout of the processing facility. Layout of the processing facility plays an important role to control cross contamination, because if the directional if it is not unidirectional, then actually there are chances of cross contamination. So flow of material as well as staff shall be unidirectional, so that cross flow does not occur at any stage. So even workers' clothing shall not touch each other during handling, which is potential source of contamination. So we have to take care of all these things actually while making the layout of the processing facility. And layout of toilet facilities, change rooms, break rooms, amenities shall be such that these will not open directly into food processing areas. So this layout actually should be such that these are toilets should not open directly to the processing areas or receiving areas. They should workers should enter through some other rooms, not directly into the processing areas. So even the ventilation systems and drainage system of toilet facilities and break areas shall be separate from food processing areas system. So we have to take our utmost care, because we know that contamination comes, potential source of contamination is toilet rooms, break rooms, and drainage systems. So we have to take care of all these things. Next slide, please. Next slide, please. Yeah, health status and wellness checking. It's a new thing actually. Wellness checking. It has been developed by US CDC, Center for Disease Control and Prevention of USA. They have actually introduced this wellness checking in view of this COVID-19 pandemic situation. But health status actually, it is almost done. It is regularly followed. Health status. Workers of the establishment shall undergo medical examination by registered medical practitioner at least once per annum to ensure that they are free from infections and communicable diseases. This is very common actually. Every even FSSA also in their guidelines actually said that all the workers of the establishment shall undergo medical examination by registered medical practitioner at least once a year to ensure that they are free from infectious and communicable diseases, and they shall be vaccinated against the entire group of diseases as per schedule of vaccination. And record of this examination shall be maintained in the office of the establishment. When some inspector goes for checking the unit, actually they will check whether the workers have been vaccinated properly or have been medically examined. So, but this wellness reporting is a process described by CDC, Center for Disease Control and Prevention USA, for this pandemic, COVID-19 pandemic situation. And what is wellness reporting? Wellness reporting is a process to check whether the workers are showing symptoms of COVID-19 or had close contact with somebody who has been presenting symptoms or has recently traveled. So these are the things actually covered under wellness reporting. It can be used to eliminate the risk that the virus is transferred to customers through food packaging. So the objective of reporting is to eliminate the risk that the virus is transferred to customers, to minimize the risk. So that is the objective of wellness reporting. And wellness reporting should be conducted as soon as employees, other essential workers like vendors, delivery drivers, maintenance workers arrive at the establishment. So wellness reporting should be done on everybody, not only on workers. Next slide, please. Next slide, please. Yeah. So if an employee believes to have developed COVID-19 symptoms during the shift, they can take self-assessment at break time. So this is also a new thing, self-assessment of the employees. So employees should assess themselves whether they have any symptoms during the shift, or they can take at the break time at least, they should self-assess whether they have any symptoms of COVID-19. They have developed symptoms of COVID-19. And self-assessment of all employees to be enforced. And they should be clearly told that they should assess themselves during break time whether they have developed any COVID-19 symptoms, and self-assessment of all employees to be enforced regardless of whether or not they are showing symptoms. Whether they are showing symptoms or not, they should do self-assessment. And employees shall inform the PIC, project in charge, of symptoms of illness and injuries before start of work, at break time, at start of shift. So every time actually before start of work, employees should inform the PIC whether they have any symptoms of COVID-19. And these self-assessment posters, to make it more meaningful, self-assessment posters shall be displayed in break rooms, change rooms, toilet facilities, so that workers take it very seriously. And if the workers are suspected, they shall be restricted from handling food until they are deemed fit by a registered medical practitioner. So, so these are all essential constituents of the self-assessment and wellness reporting. The next slide, please. Yeah. So, if an employee is confirmed to have COVID-19, first it is necessary to exclude this individual from others in the workplace. That is the first thing actually you have to do, from the workplace, and remove individual from the processing areas, complete processing areas, and call workers emergency contacts, because all the workers must have some emergency contacts, and that emergency contact should be informed. And local health services, because of this pandemic situation, we have to inform the local health services and send the workers actually home immediately without waiting for anybody's instruction. So so these are the wellness reporting. These are important parts of wellness reporting, and all close contacts of the infected employees should be notified. All close contacts of the notified employees at work and should be notified, and they should be requested to leave for isolation for a minimum period of 14 days, because they should not, even the close contacts should not be allowed to work. They should go home and leave for, they should leave for isolation for a minimum period of 14 days. And the surfaces in their workplace shall be immediately cleaned and disinfected, because not only the infected worker but the close contacts also. And persons who had contact with the ill employee during the time the employee had symptoms, and 2 days prior to symptoms should be informed, because they are also considered to be positive. So persons who had contact with the ill employee during the time the employee had symptoms, and 2 days prior to symptoms should be informed. And the others with close contact within 6 feet of the employee during this time would be considered exposed. If they are within 6 feet distance actually, and for more than 10 consecutive minutes, they should be considered as exposed until they have had 2 consecutive negative tests collected a minimum of 2 days apart. Employees are not allowed to return. So all the infected employee and the workers who are in close contact should not be allowed to return unless they have took consecutive negative negative test, COVID test, collected a minimum of 2 days apart. All these employees are not allowed to return. So yeah, we should be very strict on this. Yeah, next slide. Yeah, documentation of wellness reporting. Whenever we do something, actually, we usually document the whole process, and this is essential also to for contact tracing. Actually, documentation is important for taking the correct precautions to reduce risk, and also for contact tracing. Anyone coming into the facility or office, and office will be screened. First thing, actually, they should be screened. Their body temperature will be measured, and screening process actually include taking their temperature through some thermal guns and asking them 7 questions. What are these 7 questions? Number one, within the last 14 days, have you experienced a new cough that you cannot attribute to another health condition? So that is the first question. Whether they have experienced any experience a new cough that they cannot attribute to another health condition? That is the number one question. Number two is, within the last 14 days, have you experienced new shortness of breath that you cannot attribute to another health condition? So that is the second question actually, shortness of breath, whether they have experience or not. And question number three is, within the last 14 days, have you experienced a new sore throat? Because we know these are all symptoms of COVID-19. And within the last 14 days, have you experienced a new sore throat that you cannot attribute to another health condition? So we have 7 questions. So next slide, please. I will describe the other 4 questions. Yeah. Question number 4 is, within the last 14 days, have you experienced new muscle aches that you cannot attribute to another health condition or a specific activity such as physical exercise? We know that sometimes due to physical exercise also we find some kind of muscle aches. So that actually to ask to the visitor or worker or anybody who enters the premises, within the last 14 days, have you experienced new muscle aches or not? And question number 5 is, within the last 14 days, have you had a temperature at or above 100.4 degree Fahrenheit, which is equal to 38 degrees centigrade, or the sense of having a fever? So that is very important actually. But always actually it is not necessary that they should have temperature every time. But these are all symptoms. So within the last 14 days, have you had a temperature at or above 100.4 degree Fahrenheit or 38 degrees centigrade, or the sense of having a fever? And question number 6 is, within the last 14 days, have you had close contact without the use of PPE with someone who is currently sick with suspected or confirmed COVID-19? And what is close contact? Close contact is defined as within 6 feet for more than 10 consecutive minutes. So that question is very important actually. Sometimes the workers or in their house or in some other places, they may come in close contact with somebody without the use of PP who is currently sick and with suspected COVID or confirmed COVID-19. So that is the 6th question. And 7th question, and the last one is, within the last 28 days, it is for 28 days, have you traveled anywhere? If yes, please state travel history. So that is important actually, because we have seen that most of the workers and personnel actually they brought it from some other places. So if yes, actually, please state travel history. Worker or employees or visitors uh, or anybody actually who is entering the premises, they should inform all these 7 questions. And so the screening process involved taking temperature and asking these 7 questions. And if the individual answers yes to any of the questions, they will not be allowed into the facility unless determined otherwise by a designated medical professional. Because sometimes actually these are all symptoms, but these are not definite symptoms of COVID-19. But we cannot take any chance actually. So that individual should be checked by some designated medical professional. And if the medical professional allows the individual, then actually will allow the individual to work. So this is a very important thing. This is wellness reporting developed by Center for Disease Control and Prevention of USA. So next is training of employees. Yeah, next slide. Next slide. Yeah, training of the employees. So many developments have happened over the last 6 months, and employees are not thoroughly aware of all these things. So training of the employees is essential to get them acquainted with all these facts and the preventive measures. So all persons involved in food handling should be aware of their role and responsibilities to avoid contamination, because only the managerial staff cannot do anything. Everybody actually, it is everybody's job actually. All persons involved in food handling should be aware of their role and responsibilities to avoid contamination. they should have necessary knowledge and skills to properly handle food hygienically. So that actually we usually, all the workers are usually trained, but because of this COVID-19 pandemic situation, we emphasize these things once more to the employees, how to properly handle food hygienically and adhere to good hygienic practices. And the workers actually, they should be trained in food hygiene and sanitation commensurate with their work activities, because the work activities in any establishment is different for different workers. So they should be trained in food hygiene and sanitation commensurate with their work activities, nature of food handling, processing, preparation, packaging, storage, service, and distribution. So accordingly, all these workers should be trained. They should know their role and responsibilities. And there shall be periodic essential assessment to check the effectiveness of training, to ensure that hygiene and sanitation are being carried out effectively or not. Unless you check your training assessment, actually, then it is a futile exercise. So there shall be periodic assessment to check the effectiveness of training, to ensure that hygiene and sanitation are being carried out effectively in-house. Because of this COVID-19 pandemic, actually they cannot be sent to any other place. So in-house COVID-19 awareness training shall be provided to every worker. So inside the premises itself, actually workers should be trained, and to how to tackle this COVID-19 pandemic situation. And FSMS corona, FSMS means food safety management system, coronavirus and pandemic preparedness plan, crisis management protocols. These shall be implemented throughout the organization. So these are very, very important actually. So training should include all these things actually, this FSMS, coronavirus and pandemic preparedness plan, crisis management protocols. Because I have already explained how to tackle if some employee is found to have suspected COVID-19 or confirmed COVID-19. So these are all actually crisis management protocols. So these shall be implemented throughout the organization. So these are very, very important. Next slide, please. Next slide, please. Next slide. Hello, next slide.
Sir, did you get the next slide?
Yeah, next slide is a cleaning and sanitation of the establishment.
Yeah, it's showing on
Cleaning
the
and,
screen, sir.
it's not showing, but I sent the
Could you
entire
could
thing.
you
But I can
refresh
explain.
actually my screen? Actually, it's not.
It's not on
Could
the
you
screen.
refresh your?
Okay, let me. Uh, I have already sent it.
Yeah, it's there in the PPT, sir. Actually, it is showing on my
Mhm.
screen, but it's not showing
It
on
is
the
there
screen.
in
So
the
could you
PPT, no?
yes,
So,
sir. Could
but
you
not on
refresh
the.
your screen?
So I can explain actually. I can explain.
Sir, if you can refresh your screen once, if you can refresh your window once, I mean reconnect to it. Could you now see the slide, sir?
Yeah, but should I explain orally? Since the slides are,
Uh,
I can also explain, no issue.
Sir,
Yeah,
the
it is.
slides are showing on my.
Let me explain actually. So that
Yeah,
will
yes, sir.
suffice.
No problem.
Hello.
Yes, sir. You can go on. You can start explaining, sir. You can explain, sir. You can explain. You can start.
Yeah. So the next slide is actually cleaning and sanitation of the establishment. This is very important in view of this COVID-19 pandemic, and we have to give more importance on cleaning and sanitation of the establishment. Cleaning of food premises and equipment shall remove food residues and dirt, which are source of contamination. So disinfection is necessary after cleaning. Every time, whenever the premises is cleaned, actually, so it should be disinfected also. Particularly if some employee is found to have confirmed COVID-19 or symptoms of COVID-19. Actually, we should immediately clean the premises, and then disinfection should follow. So without a disinfection, cleaning is meaningless under this COVID-19 pandemic situation. So cleaning and disinfection chemicals shall be of food grade and used in recommended dilution. You cannot use very strong chemicals to disinfect the premises, and also for cleaning. Actually, if it is chlorinated water, chlorine level also should not be very high. And after chlorination, if it is disinfected also, so disinfection chemicals also should be of food grade, because food will tell afterwards. Yeah. So proper cleaning and disinfection program, standard sanitation operating procedure, standard sanitation of operating procedure shall be drawn up, and records shall be maintained for the cleaning and sanitation of the establishment is required. And for the immediate COVID-19 pandemic situation, enhanced routine and frequent cleaning and sanitation shall be conducted, particularly in high-touch areas such as toilet rooms, changing rooms, and break rooms. So we have to increase the number of cleaning schedule, actually. So we have to increase the number of times actually cleaning is done. And if an employee is suspected or confirmed to have COVID-19 and has been excluded from the workplace, the processing areas where the infected individual worked must be immediately cleaned and sanitized and disinfected. So this is very important, actually, because in spite of taking so many preventive measures, we cannot completely avoid symptoms, because workers are going to their house and they can be contaminated from their house also or from outside. So if an employee is suspected or confirmed to have COVID-19 and has been excluded from the workplace, the processing areas where the infected individual worked must be immediately cleaned, sanitized, and disinfected. So this is all about cleaning and sanitation of the establishment. Next is waste disposal. That slide is available. Hello.
It's actually showing on my screen. I don't know why it's not showing on your screen.
Yeah, but others are watching, no?
Yes, sir. Others are being able to. Sir, can you reconnect to the webinar once more? Can you reconnect to it?
How to reconnect actually? Tell me.
You can just refresh your window, sir.
Should I stop the recording?
So you can refresh your window once. Sir, click on your window.
Click on.
Sir, click on the top, like the search button, and refresh it.
Okay, let me try. Let me try.
Yes, sir.
অন্য এটা আরেকবার রিকানেক্ট করতে বলছি। রিকানেক্ট করে। স্লাইড দেখা যাচ্ছে। Hello.
Yes, sir. Can you turn your video on?
Yeah, yeah,
Turn the video on, sir.
yeah.
Now, are
I
you
turned
able
the
to see
video.
the?
So this is the slide. Actually, I have already explained one slide, cleaning and sanitation of the establishment. So now I am going to
Yes,
explain
sir.
on this. Uh, yeah, cleaning already I have explained. So now it is. Should I
This
explain
one.
it once more? Should I explain
No, sir.
that?
Waste disposal. Are you being able to see?
Yeah, waste disposal I can see actually. I can explain also. So let
Yeah,
me
you can start with
with waste disposal or from the previous slide. Previous slide I already
from this one
explained.
only.
This
Yes,
one
sir.
also.
Waste disposal only.
Yeah, yeah. So waste disposal is an integral part of hygiene and sanitation maintenance in food processing industry, because we know that a lot of waste is generated in food processing industry, and it is an integral part of hygiene and sanitation. We should not allow waste to be accumulated to a great extent, because waste is a source of contamination. So food waste, non-edible byproducts, and other refuse shall not be allowed to be accumulated in food handling and storage areas. So remove waste frequently depending on the volume of work. Sometimes actually waste may not be that much, but in some operation actually waste is more. So we have to remove waste frequently. We should not allow waste to be accumulated. And no daily removal of waste is mandatory for any factory. So daily removal of waste is mandatory, but sometimes we generate a lot of waste actually even during the shift. So no waste shall be kept open inside the premises and shall be disposed of as per local rules and regulations. In some places actually municipal corporation they have some local rules and regulations. In fact, sometimes they send their vehicles also to clear the garbage, and so we have to act accordingly. And but one thing shall be kept in mind, that no waste shall be kept open inside the premises, because waste is a potential source of contamination, and it shall be disposed of as per local rules and regulations. So next slide. I think the last slide I have come. Yeah, conclusion. So maintenance of hygiene and sanitation of the establishment as well as personnel is of paramount importance to ensure safe food and safety of the workers. That is because we should not only ensure safety of the product, but have to ensure safety of the workers as well. And it is equally important to maintain proper temperature for heating, cooling, cooking, thawing, freezing, storing, to ensure the safety and suitability of food. Because if the proper temperature is not maintained actually, according to the suitability of food. Actually, the food will be of its quality will be much less from the expectation. So this maintenance of proper temperature is required at every stage, because we know that food safety is a long chain. Actually, if we fail to keep safety at every stage, actually, then the ultimate result will be negative. So food premises shall have adequate natural or mechanical ventilation, not only for food items but also for workers convenience. This is also a very important part, because for factory inspectors, actually, when they visit factories, even the FSSA people also work, inspectors, when they visit any food premises, they see that whether adequate natural or mechanical ventilation is there or not. Because without adequate natural or artificial ventilation or mechanical ventilation, food items cannot be kept in its true quality, and also workers also should not feel inconvenience, actually. So that is important, actually, adequate natural or mechanical ventilation. And then adequate natural or artificial lighting also shall be provided to enable the personnel to operate in a hygienic manner. So lighting is also required in every where, and workers should work under adequate natural or artificial lighting, and lighting fixtures shall be protected to ensure that food is not contaminated in the event of breakage of lights. If the light is broken, actually, during the shift, actually, then it may fall on the food products. So the lighting fixtures should be protected. So this is an essential part of, and during layout also it is taken care of. Even before giving license to any premises, actually, this point is taken care of. And the primary focus of additional enhanced hygiene and sanitation measures is to keep COVID-19 virus out of business. So that is the only focus we have to keep in mind, uh, for which actually you have to take some additional enhanced hygiene and sanitation measures to keep COVID-19 virus out of business. And the virus can, because we know that the virus can enter only when infected persons enter or contaminated products, items are brought into the premises. Without these, actually, COVID-19 virus cannot enter in any food product or any workers. So we have to, in view of COVID-19 pandemic, every effort shall be made to keep coronavirus out of food businesses, as virus can enter through infected person, contaminated products only. So that's all. Thank you very much uh, for giving me an opportunity to speak in the webinar. About, so sanitation and hygiene may not be is of great significance, actually, in any food processing unit because of this COVID-19 pandemic situation. Thank you very much. Any question?
Thank you so much.
Yeah.
Yes, sir. It was a beautiful and informative session, sir. And I think we have received a single question, sir, in the chat box. And the question is for the food workers, if somebody is
Mhm.
suffering from diabetes or hypertension, what tip would you give them during this pandemic?
No, diabetes, and because if the workers is more than 55 years old and is having serious, severe diabetes or high pressure, he should be discouraged to work, actually, during this COVID-19 pandemic, because we have to ensure safety of the workers also. So I think that is my advice, actually. But even then, if the worker is very fit, they can take up the job. Actually, they can work, but they should be very careful, because they are very much susceptible to this virus, this diabetes and diabetic and this high pressure people. That is my advice.
Thank you, sir. And indeed, I think it was such a beautiful webinar and such a informative session, sir. And I think a lot of people must have learned a lot. And it's actually a day to learn as well as today. It's a Teachers' Day for everyone. So we have must have learned a lot. People who are attending must have learned a lot from this webinar, sir. So thank you so much, sir. And before we end it, sir, I'd like to tell everyone who is watching us live and everyone who has registered for the webinar that you all will be receiving an email with feedback link and with certificate download link for the webinar on food and safety of food and food workers in the COVID pandemic. So nobody needs to panic about how they are going to get the certificates and the feedback links. Everyone will be receiving it shortly. So before we end it, I would again like to thank Dr. Pradip Chakraborthy, sir, for this beautiful information on the webinar of safety of food and food workers in this pandemic. I think sir has explained it beautifully how we are going to tackle this pandemic. So thank you so much, sir. Thank you so much again for this informative session. And I would like to work with you in the future with different other topics related to food and food workers. So we assure everyone that we'll be coming up with more food and nutrition webinars in the near future, and we will keep you updated in our social media pages as well. So till the next time, we would urge everyone to stay home and stay safe during this pandemic time, because now the country has started recording more than 80,000 cases per day, which is a very alarming situation. So we would urge everyone to stay home and stay safe, and keep their families safe as well. So thank you so much, sir, and thank you everyone who was watching us live. Thank you so much.
Okay. Okay. Bye.